Hello, I'm Dr. Karim Kurji, York Region's Medical Officer of Health. Sadly, the numbers of cases of COVID-19 has definitely been going up. The groups that are most affected tend to be the younger age groups, 20 to 29 and 30 to 39. Our ICU admissions have also gone up, and sadly, soon COVID-19 will be claiming more lives. The folks that are admitted into ICU tend to be on the older side, and sometimes they have acquired it from their household contacts. The long-term care institutions appear to be better prepared this time around and seem to be averting much of the burden of the COVID-19 cases. So when we look at our graphs, it appears that whilst our cases have been rising and are almost at the June levels, the gradient of the rising cases is lower than what we experienced in April. This to me tells me that some of our defenses have been working and we are thwarting the virus's expansion. So, by continually being vigilant and practicing all those physical measures that we have been advising, we should be able to thwart the expansion of the virus. Businesses have to continue to be vigilant as the numbers of workplaces continues to be high. We have 10 workplaces that have confirmed outbreaks and almost 40 workplaces with suspect outbreaks. The province has recently enacted legislation preventing indoor social gatherings and outdoor social gatherings and public events at private dwellings not to exceed 10 indoors and 25 outdoors. This has been something that we applaud, as we in York Region have found that a substantial number of our cases have arisen from house parties, weddings, etc. In fact, in one instance, we had 47 cases that arose as a result of these house parties. The numbers of contacts per case in these situations is also high at approximately 7 per case. The transmission rate of cases is as much as 40%. That is to say, we in terms of our jargon use the term attack rate, but that is to say how many cases arise from a given situation. So as much as 40% of the attendees tend to come down as cases, and that is extremely high. So it is very important that we avoid crowded indoor situations, and by that I would also expand that to include any indoor situation that you go into, whether it's a tourist location or whether it is a crowded business location. Please extract yourselves if you find that physical distancing of 2 meters is not being practiced. The most important measure is the physical distancing of 2 meters. Masks provide an additional layer of protection. So you just bear in mind, if you follow these particular guidelines, we should be safe. Our schools have reopened, and we have seen approximately 10 schools on surveillance. Public health tends to identify the cases, moves in rapidly to do assessments. These assessments include checking out close contacts of the case, whether they have been in before and after school programs, whether they've been on buses, whether they have cohorts that may have been exposed, or what about exposures during recess, and of course their household contacts and siblings as well. We also try and find an acquisition source for those cases to see whether those are from within the school population. So far, most of our cases and teachers, are either teachers or students, and they have acquired it from within the community, and there hasn't been any school transmissions that we are aware of as yet, but we remain vigilant. On the whole, we've had to isolate approximately 70 individuals. Now, this number, given the large number of schools in York Region, is a relatively small number. So finally, I ask everybody to remain very vigilant, as it is through that vigilance and practice of the public health guidelines that we'll be able to get the situation under control again. So, to remind you, physical distancing by 2 meters or more, wearing masks indoors and in transit, and wherever physical distancing is impossible to maintain. Also, wash your hands frequently, and please don't mingle, don't go into places if you're sick. And certainly access testing at one of the 3 assessment centers that are open 7 days a week if you have symptoms or if you've been in contact with a case. So please stay vigilant, and we'll all be safe. Thank you.